this is Riz here from Riz Explorer, and I have come to you today with explaining a little bit more about respirators. So in the previous video, you can check out the link in the description. We discussed about the virus and its spread and the surgical mask and how it helps. So today we're going to discuss about respirators. Now, so there is a lot of confusion about what is used for, when it should be used. So respirators are usually for protecting the person in higher danger. So, you know, if you are a layman or general public, you don't really need to be wearing a respirator. So the N95s and all that, you really don't need it, because it is only if you're in close contact with a person who is infected. So if you are looking after somebody who's got COVID-19, and that may be a time that you can use your respirator, but otherwise use these respirators efficiently, because they are expensive and there is not that many around to be wasted. So the respirators is used particularly for any when we use any aerosol generating procedures. Aerosols are when the virus particles probably in the viral form, so they're not in droplet form. So if you look at this illustration done for me by Ziana Art, you can see that the hair is about 100 microns. Droplets range from about 100 microns to about 50 microns. Anything up to 5 microns would be considered as droplets. Then they are less than 5 microns would be considered as aerosols, and aerosols can remain suspended in the air, settle anywhere, they can travel up to 20 feet. So those are the bigger dangerous particles, and especially in dentistry when we're using the aerator, or if you use both the air and the water in the 3-in-1 syringe, or if you use an ultrasonic scaler, all those are aerosol generating, because if the patient's saliva is infected, we will be splattering it all in the room. So we will need to protect ourselves. Now, the respirators were initially actually made not for for fighting bacteria and viruses. So it's actually in the construction industry, in gas and petroleum industry, to protect the personnel from inhaling dangerous vapors or particles that are very small, like dust particles or asbestos, and that is why. So surgical masks, I explained to you, we check, the most important thing we check is the bacterial filtration, the breathability. We do check the particle filtration, but it's not done very well and it is not very efficient. And then obviously flammability and fluid resistance. These are the similar things that we check in a respirator, but in a respirator, the FFP. So there are two different standards. There's a European standard and then there's American standard. In the European standard is the FFP, so the phase particle filtration. So that is what is considered as the different types. Again, I'll come to that in a second. And in America, it's it's just by the 95, 99 and 100%. So 100, that is the particle filtration efficiency, and that's how the respirators are classified. Like I explained, the bacterial filtration efficiency is not considered very well, because these respirators were not really initially made for the healthcare industry. So for us to get a good idea of the overall picture of the different types of respirators, if you look at this diagram here, so the Health and Safety Authority has divided the respiratory protective equipment as two types. One is air purifying and the other is air supplied. So air supplied is like for scuba diving, or if you need to be supplied with oxygen, those kind, which is not going to be discussed today because it's well out of the topic. But we are going to discuss the main topic, that is the air purifying respirators. Now the air purifying is again further subdivided into non-powered and powered. Okay, so now in the non-powered, there is the disposable respirators. So that's the one that you all are probably very familiar with, all the N95s and the FFP2s, the FFP3s, all the disposable respirators. The second type is a half shield reusable respirator, which I will show you in a second. and the third type is a full face shield reusable respirator. Now in the powered, again it's a similar, so it is a half face shield, but it will have an additional powered air that comes through for the person to breathe. So it will not be oxygen, but it's just the air from the atmosphere is pumped in through the mask, so that it just helps with ease of breathing. So again, the powered, there are three types. There's a half face shield mask, there's a full face shield mask, and a hood type, which I will demonstrate to you at the end of this video. As explained in the previous video, the corona particles is about 0.1 microns. So if you look at all the respirators, you can see that it mentions the particle filtration of 0.3. I don't know if you've really noticed that. So 0.3 microns is the magic number everyone's talking about. So do you understand why it is? So when corona is so much smaller, so what they did is they did a lot of tests and they found that the maximum penetrating particle size, the MPPS, is actually 0.3 microns. So they put the mask under pressure and sprayed different particle sizes, and the bits that got on the other side, the maximum number was the 0.3. So why is that 0.3 important? So anything more than 0.3, obviously the masks have got different layers of protection, and it will keep the because of the size, it will keep it within with preventing it from penetrating. And anything less than 0.3, they found that there was not sufficient mass for it to penetrate the masks, and that is why sufficient mass for it to penetrate the mask, and that is why the 0.3 is the notorious number that we are trying to keep out. Although there are the viruses and bacteria are, especially COVID, is 0.1. So that is why the notorious 0.3 is important to understand. Now the particle filtration efficiency. So the European standards, if you have to go through the numbers, there's the umpteen number of, it's different for disposables, to the half face shield, to the full face shield, to the PAPRs. So we won't go through any of the numbers, but there is many guidelines for all of it. I can give you, we'll be putting the description, a link in the description below. The filtration particle, so FF is face filtering particle face mask, is actually, so N95 or the FFP1s filtrate up to 80%. The FFP2 or the N95 are the similar equivalents. They protect the person wearing it up to 95% of the particles is filtrate, particularly this 0.3 microns is filtered, and then the FFP3s can filter up to 99% or 90, or its equivalent is N100 in the American system. So it is the particle filtration that is important when we come to respirators. Now in the American standards, you also see here about this number N or R or P. So N means that it is non-resistant to oil, so you cannot use it. So like I said, it was meant for other industries, so it's not really relevant for us. The R stands for relatively resistant to oil, and P is strongly resistant to oil, but it does not it's not applicable to us, but just for your own understanding, it'd be good for you to know. So I'm just going to take you through a few of the N95s I could get my hands on. So they come either as folded disposable ones, they come either as folded like this, or they come as cup shaped like this. Now the folded ones, you can have them wired outside like this, or the wire is inside like this. Now these are all N95 or FFP2 equivalent, so that is the recommended guidelines for any AGP procedure, but these have to be fit tested to make sure that it protects you to the correct level. And so I have had a few fit tests, and I actually didn't pass in any of the fit tests on any of the FFP2s or N95s. These can also come in as ear loops, so just very similar to surgical mask, and it just goes on and then, but if you can check, the seal is actually very good when you compare it to a surgical mask. Or it also comes as head it goes on the head. So if you just bring these down here, how you wear it is that you hold it with the your headpieces hanging down, and then the wire bit goes on top, and then you just kind of, so these give you a bit better seal, but again, as you can see, yeah, the seal is quite good. It is quite comfortable. It again depends on the shape of the face and the person. So I did not fit test on any of the N95 or FFP2s, unfortunately, but this is all that is needed for a lot of people depending on their size of the face and shape of the face. The other types of the N95 masks can be, like I explained, cup shaped. Again, it's very similar. These are the ones that go around the crown of the head. The cup sizes usually don't go around the ear loop, and then again, very similar. Hold it with the when you're putting it on, hold it like that, and then these just literally go one on the top of the crown and one at the bottom of the head. And again, this does give quite a good seal with an FFP2, and it is actually quite breathable. And it is quite comfortable, and you can adjust this, and if you pass the fit testing with it, that's fine. So something else that I noticed is the one of the practices that we work at, we got an FFP2, but it didn't have any of the markings that you should really be seeing with regard to masks. Otherwise, you have to figure out a fake one. So it should have a NIOSH number. So I will be putting a description of all the numbers that is needed on your mask to see if they are not fake, because having non-fake ones which are tested is so important, because these are to protect us from getting the COVID, which is actually a killer. So something else that also in FFP2 that we need to know is these that come with filters. So the FFP2s that come with filters. Now, again, like I was explaining, these are not made for our industry. So the problem with these is that you will be breathing out onto the patient, because this does not protect the patient from us if we are non-symptomatic COVID carriers. So that's when you wear these, you need to wear a surgical mask over this to protect the patient, and that can make the breathability of these quite difficult. Again, the FFP2s, they come with quite a good seal with these ones, and I actually fit tested positive with these FFP2s, this particular brand. Yes, but they do come with all the markings, the EN markings, and so this as well comes with all the EN markings, or it will be the NIOSH markings if it's in the American guidelines. Now coming to the disposable FFP3 masks, the king of it all is the 3M FFP3 masks, the foldable. It comes as a foldable one, and this is supposedly the best one, which is fits almost everybody. It's most comfortable. It is quite expensive, so all you do is you put it on, and then you put the head ties on, and one on the crown and one at the back, and you adjust, and the fitting is really good. The seal is very good, and almost everybody I know has fit tested for these, but the only problem is that it is so in shortage, and it is only available to the hospital premises. So this is the 3M FFP3 disposable foldable type. Now you can also get the FFP3 cup shaped. The difference between an FFP2 and FFP3 is that these are adjustable, so you can adjust it to make it fit to for you, so that it gives it a good seal. So that's how it is different from FFP2. Again, it's very similar. You hold it back down like that, and then you hold it on your face and then put it on, and then you can sort of adjust it. It's come off though, but yeah, you can sort of adjust it like that with these. You just pull it tight, and that just kind of really gives it a good seal for an FFP3 mask. Which again, the only issue though is that there is the valve where you're breathing out. So in all the primary care trusts where they were seeing patients, what was advised was that so there is you can wear these masks for again in one of the studies has shown that you can wear it for up to about 8 hours. Otherwise it's really a disposable, but because of shortage, what we have been doing is wear the FFP3 mask, disposable, and then wear the surgical mask on top of it and change that after every patient, and then use the FFP3 for the whole session. That means most of the nurses were working about 4-5 sessions, 4-5-hour sessions, and they were wearing it all through the whole session. So that is about the disposable FFP3s. So we will come now on to the reusable FFP3s. So the reusable FFP3s, this is one of the most common masks that's used in UK now. This is a stealth mask. Again, there are a few different types. There is a similar one which is grey in colour as well, which I will put a picture of. I did try that. Funnily enough, I failed that with that mask, but I passed with this. So these come with these are reusable, so all you just do it wipe clean, and they come with filters. So you can just have to change the filters. The filters probably you've got to change maybe once. They say once in 24 hours or once in 1 week. But again, those are for when there is a lot of dust and that sort of area. In dentistry, I think we probably should be okay for it to go up to 28 days is what I understood from all my readings, because otherwise it works out to be very expensive. So these filters for the stealth, and they are quite comfortable. I can wear my loops with this, so that is the best thing that I found. So and I fit tested for this. So all you do is you put it from the bottom of the face there, on the head there, and then this bit that we have to tie and adjust it, and then you just put it tight, and as you can see, it's quite tight, and I can wear my loops with this. But as you can see and you can hear, the talking is very difficult. It's and after some time you start this bit of your face starts hurting. But so yeah, ADP procedures is not a fun game. But this is what we are using at the moment, and then we have thankfully an hour of fallow time. So as you can hear, the talking is very difficult with these reusable respirators, but hopefully we will move on to the lesser faces, and we will not need to be using that. Another type of half face shield reusable respirators is these ones from JSP. There is 3M ones. Again, they're there in different sizes. These filters come again. So this is a P3 filter. You just need to change the filter, and these are reusable. So very similar. You just put it on. I could not wear my loops with this mask. Again, very similar. You kind of just knot it behind. But I could not, then you tighten it so that it has a very good seal, but this was a bit more comfortable for me, but I could not wear my loops at all because of this bit being quite prominent. So I did not even try a fit testing because I passed in the other one. But this is one of the other common reusable half face shield respirators that is available in the UK, and a lot of my friends actually in the Middle East all have been using these reusable half face shield respirators. We have gone through the disposable FFP2s, FFP3s, the half face shield masks. Now all of those need to be fit tested to qualitative fit testing, which I have done another video for, how to show you how fit testing is usually done. And now we are coming to the next type, which is a full face shield respirator. So as you can see, this covers the whole of the face. It comes with filters. Again, you can choose the type of filter. So this has come with an N95 filter. So you can change the type of filter. So the P3 filters are quite difficult to get hold of. Now these full face shield masks have to be quantitatively fit tested, so you have to go to a place where they do the quantitative fit testing. So the normal fit testing is not enough for these, and the advantage is that you don't have to wear the extra face shield, and it protects all of the. So I'll just try it on for you. So you just put it on and then goes over your head,
and then you sort of, so with these you can't wear, I couldn't wear my loops because there is not enough space in here to wear your loops, and then you just tighten it, and as you can hear, the voice is not very clear, but my visibility is very good. So although I can't wear my loops, I can still, my visibility is very good, and it is quite comfortable. So this is a full face shield respirator. These also now, the half face shield and the full face shield come also in the powered type. So I will be demonstrating the hood type powered respirator, but you also just need to know that you can have the half face shield I showed you earlier and this full face shield. You can come with an air purifier as well, which kind of really makes these quite good and very comfortable to use. But the only problem is you can't wear loops with the full face shield, but you can wear with the half face shield ones. So that is a quick roundup of all the respirators for you.